Hello everyone, welcome back to my YouTube channel. How are you all doing? Okay, in today's video we shall be discussing very important premarital medical tests for would-be couples to do before marriage. To my OG, thank you so much. You know I love you, right? Thank you for watching my video and subscribing. If you're new here, please hit the subscribe button, turn on the notification bell, join this love family. Okay, so without wasting much time, let's dive right into today's video. So one very important test for will-be couple is blood group and rhesus factor test. Okay, blood group. Blood group is the one that has to do with O positive, O negative. You understand? Now, the negative or the positive beside the blood group is what is called rhesus factor. As a lady, if your rhesus negative, like the sign of minus negative is close to your blood group, and your partner is rhesus positive, your children will likely inherit your rhesus negative or your father's rhesus. When the woman who is rhesus negative gets pregnant with a fetus, with a baby who is rhesus positive, it will lead to something called rhesus incompatibility. Okay, and what does that means is your body will see the baby in the womb as a foreign substance, and it will treat it as such by producing what is called antibodies. I call those antibodies dangerous soldiers that will pass through the bloodstream and attack the baby. This is very dangerous for the baby because it can lead to heart damage, it can lead to brain damage, it can lead to miscarriages, it can lead to jaundice. Okay, it's very dangerous for the baby. So as a lady, if you're rhesus negative and your partner is rhesus positive, what you have to do is just go see a doctor. Okay, go see a doctor, and the doctor is going to place you on a drug called immune globulin. What this drug does is it will prevent those antibodies from producing, and you'll be healthy, and your baby also will be healthy. And this happens usually after the first pregnancy. Okay, it comes up in your second pregnancy. A very important test to go for as a will-be couple is the genotype test. Okay, for the sake of your innocent unborn children, please go for this test. It is really important because it will affect your children more. Okay, the genotype test is the one that has to do with AA, AS, and SS. If both of you are AA, kudos, you can go ahead with the marriage. If one is AS and the other one is AA, kudos, you can go ahead. But if both of you are AS, or one is AS and one is SS, please, for the sake of your unborn children, let's forget about love for now. Don't go into it. Okay, unless you've decided that you don't want to give birth to children. Okay, because if both of you are AS, or one is AS and the other one is SS, there's a possibility, there's a high chance that at least one or two of your children will be SS. And I'm sure you wouldn't want to know the stress involved in having children with SS, because the hospital will be your second home, and the pain the children will be going through, you cannot measure it. Okay, so please, for the sake of your unborn children, go and do this test. It is very important. It's really important. Another very important test for you to do is sexually transmitted diseases test. Okay, so it's very important to go check all these things. Go check for syphilis, check for gonorrhea, hepatitis B, hepatitis C. Okay, knowing those things will help you prepare yourself before you get into the marriage. So if you have any of those things, It will help you to treat it before you get into the marriage, so that you won't transfer it to your partner. Another very important test to do is HIV test. Okay, so as we be couple, it is very imperative for you to know your HIV status. Okay, if both of you are HIV negative, kudos to you, congratulations. But if peradventure one person is infected, just go to the hospital. Your doctor will advise you on the best measures to take. Okay, I have heard stories where one partner is HIV positive and the other is HIV negative, and they got married, and their children are all free from the viruses. Okay, you can also join your faith together and ask God for healing. There's nothing God cannot do. Okay, very important test to do is fertility tests. Though this is not a basis for marriage, it is not a must. But to me, it is important, okay, especially for couples that want to start raising children immediately after marriage. It is very important to know if you are medically sound to start raising children. Okay, so just in case there's one or two issue, you start treating it immediately before you get into the marriage. You understand? Now, few of the tests, though there are other tests you should go for, but few of the tests I suggest is, as a woman, go for hormone profile tests. Okay, check if your fallopian tube is blocked or is not blocked. Check if you're ovulating. Check your egg. Check his sperm. Okay, so just in case there is a problem, you start tackling it now before you get into the marriage. Another thing to find out is the medical history of your partner. Get to know, is your partner suffering from any disease? Okay, finding out the medical history of your partner will help you equip yourself and know how to manage your home and life in general. Okay, so if you watch up to this point and you've not subscribed, and oh, please hit the subscribe button, like, comment, share. Okay, turn on the notification bell so you'll be the first to be notified each time we upload a new video. If there are other tests you think will be couple should do before getting into marriage, please drop it in the comments section below. Okay, thank you for watching up to this point. I love you all. I'm going to see you all in my next video, and until then, stay blessed.